My name is Paul Gold. I'm a core faculty professor in the School of Technology at Capella University. I'm also a research psychologist focusing on electronic media usage among college students. I'm particularly interested in online gaming addiction and have completed many postdoctoral addiction studies courses. My dissertation, Electronic Media Choices and the Relationship to Social Adjustment Among College Students, is freely available to college institutional research departments upon request. I have personally worked as a full-time professor since the year 2000. Whether one is a college instructor, an administrator, or a counselor at either a traditional college or an online university, we all stand united in one common goal, and that is student success. A strong indicator that we have contributed to student success is graduation. Yet, as educators, we want to assure that all students have been given the necessary skills to succeed in life and to contribute to society as a whole. Yet, many students who start at college do not complete their education. This creates a lose-lose-lose scenario. Students may feel they've lost their way in life. Parents may feel that they've lost some of the investments in their child's future. Colleges themselves lose significant amounts of tuition revenue due to student attrition. In 2016, I completed my study entitled Electronic Media Choices and Their Relationship to Social Adjustment Among College Students. This was also my dissertation. For several decades, social adjustment to college has been shown to be pivotal to college student retention and success. The Student Adjustment to College Questionnaire SACQ has served as the primary instrument for measuring student social adjustment well before the advent of the internet. In today's high-tech society, it comes as little or no surprise that on any college campus, one would see many students continually connecting with one another and the outside world, texting, emailing, Facebooking, Snapchatting, etc. Has technology had an impact on how students feel about their social adjustment to college? Do some forms of technology contribute to students feeling more socially isolated than others? Conventional thinking probably had it that the stereotypical college gamer would feel the most socially isolated on college campuses. But is this the actual case? My 2016 study involved 166 respondents, freshmen, sophomores, juniors, and seniors at traditional brick-and-mortar colleges in the United States. The study compared their SACQ scores with 4 modes of electronic media usage: online gaming, social media usage, transmitted text messages, and television watching. I was particularly interested in the role that online gaming played in relation to student adjustment to college. Of these 4 electronic media choices, television watching was associated with the lowest SACQ scores. So in other words, the more hours that students spend watching TV, the lower their social adjustment levels were. Texting, social media usage, and online gaming are all non-passive media choices, and often the point of these interactive modes is to socialize with others. This particular sample of 166 college students were college students in general. The study did not focus on hardcore college gamers who might specifically be struggling with internet gaming disorders. However, my 2018-2019 study does focus on internet gaming disorders among college students. I'm not an anti-online gaming research psychologist. In fact, I'm an avid player of Battlefield 1. My goal is to objectively discover and understand why the majority of online game players do not become addicted to games, while a minority, approximately 3 to 5% of players, seem to struggle with legitimate addiction issues, and ultimately how they can be helped. At this point in time, residence hall assistants may be the best people to offer the most candid insights about how internet gaming disorders may be impacting their fellow college students throughout the country. Internet gaming disorder is mentioned in the American Psychiatric Association's DSM-5, but it has yet to be recognized as a formal addiction like gambling is. Potential indicators of internet gaming disorders are persistent urges to keep on playing despite negative personal consequences for doing so. In the case of college students, this could mean not studying enough for a test or not getting enough sleep in order to keep on playing online games. For some students, it could mean not attending classes or failing courses because online games seem to be more important. In many instances, problematic game playing may be tied to efforts to escape from depression or from other problems. The core purpose of this study is to compare residence hall assistants' perceived preparedness to make formal or informal campus mental health referrals for students with depression, alcohol use disorders, illegal substance disorders, and online gaming disorders. A referral for the purposes of this study does not have to be a written document. It could be as simple as suggesting that a student ought to avail himself or herself of the mental health resources that are available on campus. This is an anonymous and voluntary study. As a resident assistant, your opinions as to your sense of preparedness in referring students to campus mental health centers for conditions such as depression, alcohol use disorders, substance use disorders, and internet gaming disorders will be combined with responses of other resident assistants throughout the country. The overall report, when completed, will be given to participating colleges and universities, but it will also be presented for publication to college mental health journals and in seminars dedicated to improving mental health among college students. The online survey is hosted on SurveyMonkey, and your responses are anonymous. Participation is voluntary, and no identifying information of the respondents will be recorded. We do ask a few questions about how long you've been a resident assistant, your gender, whether your dorm is male, female, or co-ed, and the name of your college or university, so it is clear which institutions have been represented in the study. Then there are 4 sections of questions on the survey that are scored on a 0 to 10-point scale. It is important to remember that the survey is about your perceptions of preparedness. For instance, you may not have personally advised a fellow student yet about seeking help for internet gaming disorders. That is okay. This survey just looks at how prepared you feel that you would be if you needed to do so. Section A asks about your own sense of preparedness to recommend that a fellow student seek out mental health counseling on campus for depression. Section B asks about your own sense of preparedness to recommend that a fellow student seek out mental health counseling on campus for an alcohol use disorder. Section C asks about your own sense of preparedness to recommend that a fellow student seek out mental health counseling on campus for a drug use disorder. Section D asks about your own sense of preparedness to recommend that a fellow student seek out mental health counseling on campus for an online gaming disorder. Thank you for participating in my research study. This research study will help to understand how college students may find themselves struggling with online gaming addiction. With your help in its completion, copies of this study will be shared with all academic institutions who participated. The correlated data may also be useful in college mental health training seminars.